No more doubts, I'm feeling alive. With every mile I leave the past behind, say and drive. This is my state of mind.
Hello, everyone, and greetings to you wherever you're listening to me from. Welcome to another interesting episode of Sanity podcast, where we find a common ground between research and our brain health. My name is Osarimi Abe, and I'm hosting this special edition of Sanity podcast. Today, we're marking the World Mental Health Day, and with a focus on this year's theme, it's time to prioritize mental health in the workplace. We're hoping to explore this crucial topic, and to do this, we have assembled a panel of experts, and I would like us to meet them right away. Our first guest is Dr. Margaret Ojere, who is a multi-award-winning psychiatrist and the founder of Noetic Minders Health Services in Nigeria. She's a fellow of the West African College of Physicians and the consultant psychiatrist and the head of Sterling Psychiatry Unit at the Just University Teaching Hospital, I beg your pardon, Plateau Heights, Nigeria. Dr. Ojere served as the first General Secretary of Association of Early Career Psychiatrists in Nigeria, and she's a member of several local and international professional bodies, name it. And she's currently a leadership member of Governing Council of the Conflict Management and Resolution section of the World Psychiatric Association. And it will interest you to know also that Margaret partners with non-governmental and faith-based organizations to provide mental health services on the served communities, and this is part of what she's doing with us right here today. She uses her knowledge in psychiatry and psychology to promote mental health beyond health sector. And of course, she's a medical writer, mental health advocate, and produces short film. And while Margaret is not working, you should see her in her garden, or she's cooking or creating memories with her family. So Margaret, I'll say maybe after this call, we have to get a round table and maybe talk about your cooking skills and maybe get some recipes from you. Welcome, Margaret.
Thank you, Nasa. Thanks for having me.
Great. And another very special person I have on the call with me today is Eliza Gaye. And Eliza is a very interesting person. So let me just quickly give a brief introduction about her. She's raised in Cleveland, Ohio, and now based in DMV. Eliza is a seasoned human resource professional with over 8 years of experience in full cycle recruitment, business development, talent strategy, domestically here in the US, and also in emerging and developing economies. And over the years, Eliza has gained experience in talent acquisition, succession planning, talent management, training, sourcing, compliance, reporting, gender equity and social inclusion, and even diversity and inclusion strategies for corporate offices and global programs, that some of which have been funded by USAID, Department of State, and also Department of Defense. I've had the opportunity to listen to some people in corporate wellness, and I must say Lisa is one of the people that I've heard talked about corporate wellness and quite excites me, and I was kind of encouraged as a member of the workforce. Eliza is passionate about localization and localization in the development, diplomacy, defense community, and she has facilitated and designed capacity building training for international staff and candidates. Eliza is passionate about getting to the grassroots, mentoring young women, especially women of color in this field. And for this, she has published a white paper with Women of Color Advancing Peace and Security and Conflict Transformation, delocalizing international development and ditching the stringent staffing requirements and support national key personnel. Eliza is currently pursuing a master's degree in industrial psychology, and she holds a bachelor's degree in psychology. And to cap it off, for someone to have this whole portfolio, you should know that she's definitely a Scrum Master. As I tell you, Eliza is a certified Scrum Master. Join me, everyone, to welcome Eliza Gaye on this call, an interesting person to have discussing this crucial topic with us today. Welcome, Eliza.
Thank you. I'm happy to be with you, and you too as well, Dr.
Great. So welcome again, everyone, and thank you so much for joining me on the call. Let's dive right in. The World Mental Health Day, observed annually on October 10th, served as a global platform to raise awareness about mental health issues and mobilize efforts in support of mental health. And this year's theme is "It's time to prioritize mental health in workplace." And it comes at this very crucial time when the global workforce is grappling with unprecedented challenges, highlighting the urgent need for organizations to foster mentally healthy work environments and support their employees' well-being. This is very important because it is fundamental to national development and also to international peace. So to start with, I'll turn to you, Margaret, and I would like to ask, from a scientific perspective, can you identify some common workplace stressors and how does this workplace stress affect our brain? Go ahead.
Okay, thank you for that pertinent question. And to give context to my response, I want to start by briefly defining what stressors are. And it can be described as any stimulus, any event or circumstances, or even the threat of an event that can cause a stress reaction in an individual. And since we're talking about the workplace, common workplace stressors include excessive workload, lack of control, lack of support, job insecurities, and poor remuneration, and even organizational cultures that did not promote good working conditions and that work-life harmony. And so, to the second part of your question, as in how do they affect the mental health? In diverse ways. So we can start with the stress hormone, that's cortisol, that has been tagged as stress hormone. Although that is supposed to connote a negative thing, the stress hormone actually is a good thing. It regulates stress in the body, it promotes sleep, it promotes consolidation of memories. But when there is an overdrive with prolonged stress, now workplace stress, there's a tendency for the cortisol to be released all over the body, and it adheres to every cell, causing inflammation and invariably affecting mental health. Again, we can look at it from the angle of the structure of the brain. And when there's chronic workplace stress, it can affect the structure and the functionality. And two areas of concern of note is the prefrontal cortex and also the hippocampus. The hippocampus is referred to as the seat of memory. So when there's anything that's going to, like the stress that affects the hippocampus, you're going to be having issues with memory, learning, emotional regulation, and same thing for prefrontal cortex that has to do with executive functioning, decision-making, planning, judgment, and even memory as it were. So workplace stress can affect the brain and can affect the body in several ways and lead to several mental health conditions. Yeah.
Thank you so much, Margaret, for that. And then as a follow-up on this, Eliza, I would like you to just try to correlate some of those neurological changes that Margaret just mentioned to how it manifests in workplace based on your own experience.
Absolutely, thank you. From an organizational perspective, you may often see these effects come in lack of productivity, lack of being able to come together and work with your coworkers, communicate effectively, and low motivation at work. Sometimes that comes and then can cause further issues, which lead to more mental health stressors. So, not fully utilizing your skills at work, which can lead to work insecurity, having poor work conditions. So if you're not focused on work and you work in maybe a mechanical space or somewhere where you need to be safe, so being forgetful or not being on your best game, which can often be dangerous. It can lead to violence, harassment, and bullying in the workplace, or being subject to violence, harassment, and bullying, being subject to discrimination or discriminating, job insecurity, inadequate pay, poor investment, and career development can all take a hit due to your mental health. And then also kind of that balance of home and work, mental stressors that come into play. I was recently reading an article by the World Health Organization, and 2024 September, they estimated that 12 billion working days globally a year are given due to depression and anxiety, which is a cost of $1 trillion per year in productivity losses across the globe. So outside of how it affects, the individual worker, it can also affect the larger organization in terms of the bottom line, and which can also lead to further job insecurity.
Great, Eliza. Thank you so much. And I like the fact that you were able to touch on the fact that this doesn't just end with the employee or the workforce itself. It has a ripple effect on the organization itself. So moving on to you, Margaret, based on your own experience, how will you rate the current status of mental health workplace? As we know, there are some big organizations that prioritize this and are doing so well in this space. But do you think they are doing well enough? And what role do you think organizations may have to play generally?
Okay, so I think it's far from optimal. Little efforts have been put in place, and what we see is that, yes, there is a study that showed that about 81% of organizations have increased their focus on mental health of the employees. However, the efforts are usually more reactive than proactive. So it's not until maybe there's been a mishap in the workplace, or there's been a life event or a traumatic event, that will now spur them to do something to try and address it. However, what is missing, the efforts should actually be more preventive and strategies that promote mental health in the workplace. The statistics out there is quite alarming. You see rate prevalence is like 11% in the UK. In Nigeria here, the range is between 18 to as high as 92.5% that's when you look at health workers. But even at that, that's quite alarming, and not much is being done. So do organizations have a role? Yes, they do have a role. And right from management, the top, they need to drive this conversation. They need to commit to it. And the commitment should be in funds and in resources. And HR, yeah, Liza is here. She knows HR is the bridge between the employers and the employee. And so strategies that are mental health friendly, like, maybe Eliza will give us some more, but several strategies that will promote mental health should be encouraged. And training should be done at all levels, not just at management level, but even at every single cadre, so that one can recognize, or colleagues or employees can recognize mental health signs or symptoms in their colleagues early. Support systems should be established so that they have this body thing and they can relate to those individuals, because usually lower cadre employees don't want to meet higher cadre employees. So when you have support groups in each cadre, it helps. So training goes a long way, and several other approaches that will drive productivity and wellness in the employees.
Thank you so much, Margaret. And I see that you try to kind of say something around professional help, because training, has to still come from some professional bodies. And I have a follow-on question on that. But before I go to that question, let me come to Eliza. You heard Margaret say something around some of these things that could be done in workplaces. Some organizations have prioritized mental health, as she mentioned, and based on some statistics that I have also read. But what strategies have you seen work? What worked, what didn't work? Are there some learnings that we can maybe take on, or that organizations can pick on going forward?
No, absolutely. Thank you. I completely agree that a lot of organizations have taken on mental health, and in the organizational psychology where we talk about psychological safety at work and resilience, and how to create a space where people feel comfortable to share and to be open to seek mentorship, or to present new ideas and kind of take risks at work. But I do think that there is kind of the divide of putting it externally versus really taking the ownership. I think a lot of organizations may have set a policy around flexible working hours or mental health days, doing mindfulness workshops, providing wellness stipends even, or doing the managerial training. But to doctors' point, it really does need to be intertwined in every single piece of the organization. You can't just have a policy that says we care about this without making sure that the managers, the staff, the assistants, the custodians, everyone has a role to play in making sure that this is a psychologically safe workplace. If you have all of these policies but it's not a psychologically safe atmosphere where someone is able to even take advantage of those policies, or feels that if they do take advantage of these policies, it will be frowned upon them, whether that's for gendered reasons or ableist reasons, whatever the case may be, it can really be challenging. So how can you create an atmosphere that really opens the door and creates a safe space for people to even take on these policies? And then just putting it out there, how are you being accountable? I think a lot of organizations, for me, myself, when I ask even my own organization, how are we holding ourselves accountable? What reports are we running? What statistics are we looking at? A lot of the organizations don't have much to say. What are you doing to hold yourself accountable to these policies? How are you actually measuring if they're working?
Thank you, Eliza. I was just trying to look at, just following up on what you just said now. We had this survey around mental health, and we came back with something that was quite surprising. A lot of people in the health sector, even though they acknowledge the fact that mental health is, they have the system on ground, but implementation, there is a gap between the policy itself and the implementation. And this boils down to what you just emphasized now. What are the success metrics? How are people really following up on this? Thank you so much for that. That was spot on. And then I come back to you, Dr. Margaret, and you're a clinician and you interact with patients day in, day out, or let me call them clients. From your own perspective, how effective are some of these things, some of this intervention, some of the ones that Eliza just mentioned, how effective do you think they can be? And coming back to the professional help that I told you to hold your thought on, are there ways current ways that organizations are linking up with professionals to get them on board without having to create any form of stigmatization? Go ahead.
Yeah, thank you for that pertinent question. So I think I agree that they're quite effective. And that's from both empirical evidence and what we have on ground, because we've seen that individuals that have accessed this, that use this, that apply these approaches, have done better than individuals who have not been given access, who are not aware of it. And then workplaces, now looking at it at the institutional level, workplaces that have implemented these strategies, like the flexible work hours, the mental health leave or day off, and the EAP program, we see that they actually do better. They are getting better results. They are having staff who are more productive, who report less to us for mental health care. So when you look at that, yes, it's not all perfect. It's still a bit rough. Yeah, it's like, I would say like the teething stage in Nigeria, because workplace, mental health and workplace were like two parallel lines, but it's getting better. And we're quite optimistic. Again, when you look at, and I think really that, and I tell my clients that it's very affordable, the mindfulness techniques, the relaxation techniques, and it's not limited to a particular structure or place. You can do it on your seat at your table. You can do it anywhere, while standing, while sitting, and it really does help. It might not look like much because you're not spending so much on it, but those deep breathing exercises, those mindfulness techniques, what they actually do is that they help calm the individual, they help distress. Mm-hmm. They also help to increase attention. And then when we go to the neurobiological aspect, they also help in developing the gray matter density. They increase it, and that again that's where the hippocampus is, the amygdala, and a lot of other structures in the limbic system that help memory consolidation and learning. So it does go a long way. And let's even exercise. You know, there's some offices now, some workplaces that insist that their staff partake in some aerobics or something twice a week. And exercises are healthy, releases endorphins, which is like the happy hormone, and that's also helpful against stress. It's blood supply to the brain, prevents that exercise now preventing Alzheimer's and several other benefits. So I think they're not just effective, but they're beneficial to one's health, not just mental health, but total health.
Thank you so much, Margaret. And I want to quickly look at this very last question. Would you have some take home for us looking at this theme for Mental Health Day for this year, 2024, prioritizing mental health at work based on your own experiences, generally, what I'll take home? And Eliza, if you have anything to add on to what Margaret just said about how some of these things are effective, you can also add that to your concluding statement.
I would say, I definitely agree that it is beneficial. We've seen the positive outcomes of what these programs are. So with that said, within your workplace, think about how you can set healthy boundaries, take the breaks when you need them, pause for reflection, take the deep breaths, take advantage of the programs that you have access to. If you need further information, reach out to your HR business partner or, your colleagues that you have trust in, your allies, and see how they may be able to, whatever information they may have about the programs to learn more. Leave behind the stigma of mental health, I think is a pretty big thing. I know in work, you try to separate home life from work life and mental health and all of these other things, but it really is, okay to be open, especially with those who you can trust. What happens at work does affect how you behave at home, and what happens at home affects how you behave at work. So, just really taking the space to reflect upon that and take advantage of the benefits that are being afforded to you, and also be the change you want to see and creating a safe space for others at work as well.
Great. Thank you so much, Eliza. That was spot on. Dr. Margaret, your final thoughts, and I want you to please emphasize some of those professional help that are currently available and how organizations can link up with professional help in your concluding statement.
Okay, so I think because of the stigma, one thing that has really helped is workplaces, organizations are leveraging technology now, and we're using different WhatsApp around here. It's accessible because it's more affordable, and a number of people have smartphones. So we're using things that range from smartphones on to virtual reality, and we're using it as a means of accessing care and providing care, telepsychiatry. But one important thing that is catching on in Nigeria, even though in developed countries it has been there for some time now, that's the Employee Assistance Program. And the beauty of that is not limited to a psychiatrist or psychologist, it's not limited to mental health. It caters to financial, legal issues, and other issues. It looks beyond the individual as an employee, but the individual as a person in a family, so the spouse is involved. And it recognizes that the baggage does not end at the workplace, at the door of the workplace. The employee actually carries the baggage in, and it treats the person as a holistic approach to the employee, and that is really helping because when you tell an employee to go see a psychiatrist, they go like, "Are you for real?" So the stigma, they don't want to be seen around you because it is assumed that, oh, that is the one. So they avoid us like a plague. But telepsychiatry is helping. The EAP program has really helped, and it's quite beneficial. So my final thoughts, workplace-related stress is a phenomenon with huge mental health consequences. Unfortunately, it hasn't received the attention that it deserves. And when we consider that about a third of our adult life is spent at the workplace, it's important that we begin to prioritize mental health. Organizations should see it as a must do and not a nice thing to do. And then they begin to offer and create that space that is conducive that promotes compassion, that promotes empathy, that promotes acceptance amongst employees where they can come out and everybody's free to express and share their experiences. Ultimately, it will lead to increased productivity, increased performance, and well-being of the employee. And at the end of the day, the bottom line matters. There will be profit.
Yeah.
Okay.
Thank you.
Yeah.
That was great. This I can say that even our listeners will attest to it that these are brilliant ladies. Within this short period of time, they were able to hammer on this very crucial point. And I appreciate Eliza and Dr. Margaret. Thank you so much for all your invaluable insights. I must tell you, I came with a very open mind, ready to learn, and I can tell that I've got a baggage of ideas right in my pocket right now. And I'm sure our listeners or people that will end up watching this will have a lot to learn from it. And you have shared a lot of excellent ideas with us. And we hope that this gets to all relevant stakeholders for appropriate actions. We cannot afford to joke with our workforce. And so let us all remember that our brain is adaptable. And while chronic stress has negative impact, positive changes in our work environment and habits can literally rewire our brain for better health and resilience. And so mental health and people management aren't just nice to have. They're essential for our productive, engaged workforce. And even if your organization isn't prioritizing this, start the conversation. You never can tell where it can lead to. If you found this video or this audio very much insightful, please do share and let us try to reach out to as many people as we can. It's important that we get this words out there and make sure we all prioritize mental health at workplace. If the world is prioritizing mental health at workplace for this year as a theme for the Mental Health Work Day, it means that we need to combat these unprecedented challenges. And how do we do that? We need to get this information to the relevant stakeholders, and we never can tell how impactful this may be. And so share, like, and so to all our listeners, remember prioritizing your health in the workplace isn't just about being kind. It's about creating a more productive, a more innovative, and ultimately more successful work environment for everyone. Until next time, this is Dr. Nosari Meabe reminding you to keep your sanity in drive and your mental health in top gear. Take care, everyone. Bye for now.
Same drive, I'm on the same drive. No more doubts, I'm feeling alive. With every mile, I leave the past behind. Same drive.